Strokes can happen to anyone, and they impact nearly 800,000 Americans every year. While treatment options have come a long way, recognizing the early signs can still make all the difference. Now joining us to discuss, we have neurosurgeon Dr. Kendrick Johnson from Tulane University School of Medicine. Welcome, Dr. Johnson. It's so great to have you.
Likewise, thank you for having me. It's such an honor to be discussing this important topic during Stroke Awareness Month.
Absolutely. So let's start with, what is a stroke and how common is it?
So unfortunately, stroke is a very common problem in the United States. Around 800,000 Americans every year have a stroke. It's estimated that every 40 seconds, someone also suffers from a stroke in the United States. Unfortunately, as well, around every 3 minutes, someone dies from a stroke in the United States. And very simply stated, a stroke is just a disruption to the blood flow to the brain, whether that's from a blood clot, which blocks flow to an area of the brain, which is the most common type. And alternatively, you can have leaking of blood from a blood vessel, which causes bleeding into the brain.
Now, Dr. Johnson, are there any symptoms that people should be watching for, or maybe some that they also wouldn't expect?
So this is the most important part of our conversation is recognizing the signs and symptoms of stroke, which helps improve outcomes. So we use the acronym FAST when we talk to our patients, F-A-S-T. F stands for facial drooping, meaning one side of the face drooping down as opposed to the other. A stands for arm weakness, meaning one arm weaker than the other. S stands for speech problems, meaning difficulty producing or understanding speech. And T stands for time, meaning that if you experience those signs and symptoms, it's time to call 911 right away.
Hey, that's really good to remember. Now, what are some of the biggest advances that we've seen in stroke treatment recently?
So stroke is one of the leading causes of death and disability in the United States. So it's a huge target for innovation with regards to medical and surgical treatment. All the way from the clot-busted medicine you can get in the IV if you go to the emergency room in time with a stroke, all the way up to what brought me into this space is a procedure called mechanical thrombectomy, where if you get to our hospital in time, we can perform a procedure minimally invasively, where we go inside the blood vessels and snake a small tube or catheter all the way up to the brain and either pull that clot out or suck that clot out. And what that does essentially is stops the stroke in its tracks and helps, in certain situations, helps our patients recover better from their stroke and potentially even fully.
Now, who would you say is most at risk for stroke, and what can people do to lower their risks?
So stroke can happen essentially at any age group, all the way from infancy all the way to the elderly, although as we get older, our risk of stroke does increase. The biggest risk factors for stroke are having persistently high blood pressure, things like elevated cholesterol, poorly controlled diabetes, obesity, and smoking. So the biggest things we can do for ourselves to help lower our stroke risk are managing those risk factors along with a medical professional, as well as increasing our physical activity. That greatly reduces the risk of stroke, and also stopping smoking if we do.
All right, Dr. Johnson, where can we go for more information?
So I partnered with a company called Penumbra on this initiative, and they have great resources on their website, which is penumbrainc.com/stroke. That you can go there and find any number of resources for stroke education. Also, you can Google the term no stroke, K-N-O-W, stroke, and the Center for Disease Control and the National Institute of Health also have great resources for patient education for stroke.
All right, thank you so much for joining us today.
All right, thank you.